Okay, it looks like we're getting settled here. We're still getting a few materials handed out. If you've got a green folder, and if you've got one of those white eye clickers, white plastic battery-operated audience participation tools, then you are set to go. So yes, we've got it in front. Good. So if you don't have a green folder or a white clicker, please raise your hand, and we'll have someone come down and hand those out for you. Okay, it's 3:25, so just as you are finishing grabbing your seats here, I think we'll get started. My name is Audrey Berner. I'm a project manager at the Eau Claire City County Health Department, and welcome to our first ever BFIT Forum Health Impact Assessment Workshop, or HIA. It's kind of a mouthful, so I'm going to call it HIA. I hope we're all comfortable with that, Health Impact Assessment, HIA. We're going to talk a little bit today about the HIA. About what it is in general, about a pilot of a health impact assessment here in Eau Claire, and then we'll also get you out on a walking tour, of course, of part of the Cannery District and the West Riverside District. But a few housekeeping things I do want to take care of before then. So in your folders is this pink form. Because we'll be walking near lands that are owned by the Redevelopment Authority, we just need anyone who's going to be coming on the walking tour to sign your life away down at the bottom of this form. I'm just kidding. But do please sign the form, and then Ned will be collecting them as we head out on tour today. So before the end of the presentation, you've got about 45 minutes to read through and decide whether or not you want to put your John Hancock on there. All right, so what are we going to be talking about today? Like I mentioned, we're going to start with the Healthiest Wisconsin Partnership Program grant. That was a grant that was recently awarded to a number of community and academic partners here in the city of Eau Claire. Then I'll be giving you the nuts and bolts of HIA, or HIA 101. And we've got a lot of content to go through in a small amount of time, so I'm going to try to make sure that it's not too big of a bite to chew in this 3 o'clock afternoon time slot here. Along with that, we'll be kind of working in a case study from a Gary, New Duluth, 2 neighborhoods in Duluth, Minnesota, in a HIA that was recently completed there, actually about a year and a half ago that was completed up in that part of Minnesota, and then of course get you out on the walking tour of part of the Cannery District. So a few things I want to talk about. The Healthiest Wisconsin Partnership Program grant, like I mentioned, was recently awarded to a number of different partners that include Eau Claire Healthy Communities, our sponsor for this event, of course, Eau Claire City County Health Department, Mayo Clinic, our host sponsor, as you all know, Jonah, Joining Our Neighbors Advancing Hope community group here in the City of Eau Claire, the City of Eau Claire Planning Department, and then also the Medical College of Wisconsin. So that's sort of a mouthful, but the gist is a number of community and academic partners came together and were recently awarded this grant. And what is this grant going to look at? Well, we wanted to study in the City of Eau Claire what's a good systematic way that we can start incorporating looking at health and health impacts into our community development decision making. Sometimes we have some really great community outcomes like Phoenix Park redevelopment. Wouldn't it have been interesting, though, to do a health impact study before that park was developed, and then afterward to know what sort of health impacts and to be able to track what sort of health impacts actually came, to be able to count how many people have been getting fresh food from the farmers market using the trails through that park? That would have been a great thing. And that's what some of this pre-planning for looking at some of our health, some of our community decisions and how they might impact health before those decisions are made, that's one of the bonuses. And that's what this grant is really aiming toward. As a pilot, then, as one way that we might start more systematically including health into decision making, are HIAs, or health impact assessments. So as part of this grant, we're going to be doing a health impact assessment on the Cannery District, and that's what's outlined here in red, and there's also a nice colored map of it that you should have gotten, a white stapled packet that should have either been in your folder, or there might be a few floating around in the back as well. So since the city had been making plans for redevelopment in this area for the last months to years, or maybe more, Ned is shaking his head, yes, right? I don't know the exact, many years, yeah. So the city's been working on plans for redevelopment of this area. Our community partners and academic partners were recently awarded this grant, so the timing was good for a redevelopment project and piloting an HIA for the city of Eau Claire. So that's really kind of the backstory behind why is all this happening now, and why are we talking about this here today. So it's a research project, and that's outlined in another handout in your folders that looks like this. It talks a little bit about what we're calling Transforming Eau Claire. So it talks a little bit about that grant, and then on the back side is a cheat sheet for HIA 101. So this is your take-home for a few health impact assessment points. Now, because it is a research grant, we're conducting research, and as being part of this workshop, you are part of our research. So all that means is that after the walking tour, we have a quick survey for everyone to fill out, but because it is a survey and we're doing a research project, I do just have a few things that we have to go through. So I know it's a little bit awkward. There's a yellow sheet in your folder. This is the last of our paperwork, I promise. That talks a little bit about the study. Basically, it says the Eau Claire City County Health Department, Medical College of Wisconsin are working together on this research project. The purpose of this is to learn about community attitudes toward health impact assessment. Your participation is totally optional. You are still able to participate in the workshop without taking the survey at the end of the walking tour. There's no anticipated benefits or harms from participating in this research, but if you have any questions, feel free to contact me or feel free to contact the principal investigator who's listed at the bottom. His name is David Nelson, and he's with the Medical College of Wisconsin. So I don't see too many confused looks after that, so I think we can now dive into really getting into the nuts and bolts of what HIA is about. So to do that, we have to talk about things that impact health, first of all. And we've got a range of experiences here in the audience, so we'll just take a few minutes to make sure that we're all on the same page. So what are things that impact health? Well, we call those health determinants. And there's lots of different things that impact health. I don't have to tell this audience that. But some of them have to do with what we do individually, right? Our individual behaviors or individual factors. Those would be things like what we eat, how much sleep we get, what we do and don't get for physical activity, physical exercise. Those are the types of things, those are individual factors or individual behaviors that can influence health. On a little bit broader scale, then we can start looking at things like working conditions, living conditions, public infrastructure. These are the things that maybe at a community level, some of us might have a better ability to impact, especially as planners or designers or even health professionals. Excuse me, and some of them might be a little more obvious than other ones. For example, we know pretty well that good air quality, good water quality can have a lot to do with good health. Things like noise, though, are one of our living and working conditions that we might not think about as much as a health determinant. Now, outside of sort of ear-damaging noise, we can have things like nuisance noises. Maybe your neighbor's car alarm goes off at 2 a.m. That would be a nuisance noise. That causes stress, right? Stress can increase our blood pressure. It can make us feel not happy the next day. So lots of these things can have different types of impacts on health. And if we look even broader, then we can get into things like social and economic factors. So racism, poverty, inequality. And these weren't things that were widely considered to be part of our health determinants list until about the 1940s, when the American Public Health Association, and even a few years after that, the World Health Organization said, yeah, these are things that are health determinants. We need to be paying attention to these things because they impact health. They're not just things that are out there that we have no control over. We do actually have control over them. And one of them, Dr. Fisher mentioned this morning, social cohesion, or how well we play with others, how well we interact with our environment, and especially with the other people in our environment. So my question for you is, where does the built environment, where does where we live, work, and play fit into this spectrum of health determinants? If anybody's brave enough to shout out a guess, feel free. What was that? Individual behaviors? Absolutely. I would make the argument anywhere from individual behaviors all the way out to social and economic factors. So just look at exercise, for example. That's an individual behaviors. If there's trails outside your door, yeah, that's a built environment issue, or that's a built environment bonus that can impact exercise. Your built environment can impact parks, can impact housing, can impact social cohesion. So really, it fits across a broad spectrum of these health determinants. And how am I going to tie this all back to HIA? Probably is what you're starting to think right now. Well, HIA is really about understanding this relationship better, understanding how what we do in the built environment can impact health, and understanding more specifically a particular policy, a particular project, a particular program. How does that impact our environment, and then how does that impact health? That's what HIA is all about. So now we have a quiz, and this is what your white clickers are for. So grab those out, make sure that they're on and active. Are they already on? Button on the bottom, I hear. Button on the bottom is how you can turn them on. All right. So let me get our polls started here. Does anybody else need a clicker? Yeah. Blue light should go on. Sorry. I don't know if everyone heard that. So even if you push multiple buttons, the only one that gets counted is the last one. So you can feel free to be a little indecisive, but your last vote is what's going to count on our poll here. So let me get that started. Okay, so voting is now open for your guess for what % of early deaths can be attributed to environmental and social factors. This is based on a 2011 study. I'll give you just a couple minutes here. Seconds, just a few seconds. Okay, about 5 more seconds. I'm not quite sure how many clickers we've got out here in the audience. All right, last call. Okay, I'm going to hit stop. All right. Oh, so we've got a tie between either 30% and 60%. Few said 85%, and one said as low as 15%. Okay. C is correct. Now, how many guessed C just because C is always the right answer? Right? Okay. Yeah, so about 60%. That's a lot. That's a lot. So that's outside of some of those individual factors that we don't have any control over. Those are things that we do have control over. Okay, so now we have just another audience participation question, then we'll get into some of the guts of HIA here. So this is a survey for to see, just to get an idea in the audience of how many of you, the polling is now open. How many of you have experience with some of the widely used impact assessments? That includes environmental impact assessment, health impact assessment, or social impact assessment, some or none of those. So let us know what you've got experience with here. All right, we had 28 votes last time, so I think we've got them all. All right, so it looks like the majority here have not had any experience with any of our impact assessments. Some health impact assessment experience, though, so that's great. No social impact, a little bit of environmental impact assessment. Okay, that sounds good. Well, for you environmental impact assessment folks, forget everything you ever learned about environmental impact. It's just going to confuse you here, and it's not going to be helpful. It's not going to be helpful. No, I'm kidding. There are a few similarities between some of these different impact assessments, and really what all these impact assessments have in common is that they're meant to be unbiased evaluations of potential impact. So health impact included, unbiased assessments of potential impacts. All of these impact assessments try to gather data to understand context. They want to predict changes of a particular policy or program, and then make recommendations to minimize harm. So let's compare real quickly about how these 3 assessments would look at the same project. Let's say in Eau Claire, we are considering bringing in a coal-fired power plant. If we were to do an EIA, the results might look at, as far as air quality, particulate levels, so combustion particles that would be in the air as a result of this power plant, or compounds such as oxides that would be released. If we were doing a health impact assessment, we would say, well, we're not as concerned about some of those really specific measures. We want to think about community health levels of respiratory disease rates or chronic diseases or even mortality. And if we're looking at a social impact assessment lens, we'd say, well, we're not so worried about that. We're worried about what kind of tax base this might mean, what kind of revenues we'd get out of here if we have the housing capacity to house all of the new employees that would be coming into our area. So that's how these different types of assessments kind of play well with each other when it comes to looking at one particular project that would be coming into a particular community. Now, environmental impact assessment is probably the most widely used across the country right now. It's also a little bit older. That was started in the 1970s with the Environmental Policy Act. Health impact assessment is a little bit younger than that. 1999 was actually the first health impact assessment that was conducted here in the United States. So a little bit younger, some similarities. From now on, though, we're really going to be tunneling in and focusing on what is a health impact assessment. And what an HIA is, really, when it boils down to, is just a systematic process for conducting an unbiased assessment of potential health impacts. And I'll say that again, just to help it all sink in. So a systematic process for conducting an unbiased assessment to determine potential health impacts. How do we do that? Well, we bring together scientific data. We might talk to some content experts. We might talk to some public and get some public input about what are some potential health impacts of a particular policy or a particular program. And then we use that information to come up with recommendations. So this all happens before a decision is made, before a policy is implemented. We can come up with recommendations for our policymakers and say, here's a really good way to boost some of those potential positive impacts and to minimize some of those potential negative impacts of any particular program. What are some reasons that a policymaker might go through the HIA process? And I'll just go through these pretty quickly. If they've got a decision that might impact health, but the decision itself does not consider health effects, they might do an HIA. If they want evidence to support those potential health impacts, they want to know what sort of research is out there, they might do an HIA. If they want feedback from the community, they might do an HIA, or if they want to consider health equity, if they want to know if certain subgroups of an educational level, of an income level, of a mobility level are going to be impacted differently than other groups, they might do an HIA. And there's lots of different policies and programs that you can do an HIA on, anything from policy decision that hasn't been made yet to a policy that's been passed but is not yet implemented, and there's some different options for implementing that policy. It could be very project specific, like, well, where should we put that coal-fired power plant that they've been talking so much about for Eau Claire? Not a real thing, just a joke. Or things as broad as comprehensive plans, regional plans, neighborhoods, other master planning documents. Really, the scope is open for HIAs as long as you have the time, as long as you have the resources, as long as that decision or policy hasn't gone through yet. Those qualify for an HIA. And therefore, all HIAs are going to take a different amount of time, a different amount of resources. They might be as much as a desktop review, all the way to a multi-year study collecting original data, which is much like the HIA that we'll be doing in the Cannery District. So really a broad scope, but they all follow the same sort of pathway or the same sort of steps. All right, so one more poll question here. Polling is open. So how many HIAs, what percent of all HIAs do you think are done on the built environment? So our Cannery District HIA will be a built environment HIA, obviously. But of all the HIAs that are done, I think this is just limited, though, to the United States. What do you think have been on the built environment? Okay, looks like we've got all 28 votes. %, was the winner. A few votes for some of the other categories. Okay. The Bs have it this time, 34%, actually. 34% of all HIAs have been done on built environments so far in the United States. Definitely the most popular topic, but as you can see, lots of different policies and topics that have been done all around the country and really all around the world. Like I said, time, resources, applicable decision, those are really kind of the constricting factors when it comes to being able to do an HIA. The type of policy is not one of those constricting factors. All right, so like I said, an HIA is a systematic process, which means we've got our set 6 steps. So there are 6 steps to the HIA. I'll just kind of go through them quickly here, and then we'll talk more in depth about each of them as we're looking at our case study in the upcoming couple of slides. But the first step is scoping. That really answers the question, can we? Do we have the time? Is it going to be useful? Do we have the resources to do an HIA? When it comes to the next step of scoping, well, what are we going to do that HIA on? Who's going to do it? What geographic extent? What part of the policy are we going to cover? What health determinants are we going to look at? There's lots of questions that come up in the scoping process. The assessment part then that's really the meat and guts of the HIA. That's where we collect our research on all the research questions that we identified in the previous step. That's where we're going to determine who will be affected, how will they be affected, how likely is it that people will be affected, and will it be positive or negative effects. The recommendations then say, well, what are we going to do about it? How can we change this particular policy or program, or how can we implement it to maximize some of those benefits and minimize some of those potential negative impacts? Then reporting is how we tell people about everything that we've just done for our HIA, so pretty straightforward. And then the last step, just when you feel like you should be done and you want to celebrate because you thought you just got your final report out the door, there's one more step for the HIA, and that's monitoring and evaluation. That's what I alluded to about Phoenix Park, for example, is being able to track some of those health outcomes that you thought would be pretty likely through the HIA. Actually being able to track some of those and asking yourself, well, did we do the HIA like we planned to? What were some obstacles that came up? And did people listen to our recommendations? And these are really kind of the general standards for HIA. So there is a published minimum elements and practice standards for health impact assessment. So without these 6 steps, without including stakeholders, without creating recommendations for your policy or program, then it doesn't meet the standards of an HIA. It might be a very helpful assessment, but technically it doesn't meet the standards for a health impact assessment. All right, so our case study. Like I mentioned, this will be on our Gary New Duluth Health Impact Assessment that was conducted by the City of Duluth and also the Minnesota Department of Health. And it was published about 1.5 years ago. And this neighborhood is in these 2 neighborhoods are in southwest Duluth, and they were characterized by some blighted properties, by some contaminated areas. They also had some food deserts within the neighborhoods, and overall these neighborhoods had a lower racial diversity, had a lower education level, a lower median income, and also higher unemployment when compared to Duluth as a whole. So this was an area that definitely qualified for some redevelopment, and that's where the City of Duluth came up with a small area plan. It's basically a comprehensive plan, but for a city. So it's for a part of a city. So it's much smaller scale, more detailed, and builds on some of the strategies that are outlined in a comprehensive plan. So their HIA and our case study is about that small area plan for Gary New Duluth, those 2 neighborhoods. All right, so our screening step again, like I said, this step answers the question, can we do a health impact assessment? Is there a plan that we have the time, that we have the resources to do this type of assessment on? And for our case study, throughout their screening process, like I mentioned, they identified a community that had some social and built environment concerns, to put it sort of generally. They had a small area plan which had proposed improvements, but those improvements did not carry through to potential health impacts based on that small area plan. That's where the HIA steps in. And the city staff were interested in HIA, and that is always a bonus when you have the people that are making the decision interested in learning more about potential health outcomes. That is a huge bonus, and so that really played well in this case study here. So scoping, again, this is our second step and answers the question, well, what are we going to do this HIA on? To say we're going to do it on the small area plan, that's pretty broad. That's going to set you up for a multi-year project. So we kind of need to narrow it down a little bit to decide, well, how can we make this really useful for the people that are making decisions? And that sort of comes in three different areas. How are we going to manage it? What's the scope going to be? And then what methods are we going to use? So in the case study, they came up with two sort of guiding bodies. One was the Technical Advisory Committee. This included neighborhood residents, so people that would be impacted by these changes that the small area plan proposed. Those people could weigh in. On what this HIA or how this HIA was going to communicate health impacts. And as Dr. Fisher said this morning, this is so important. This is so important to go out in the community and say, what can we do to make your community healthier? What do you want? What do you need? What isn't there that should be there for you? And HIA that's one of the practice standards and golden rules of the HIA is to include stakeholders, include the people that are going to be feeling these impacts to make sure you truly, truly do understand them. The scope then, so what are we going to actually do this HIA on? Well, they decided there's three health determinants we really want to look at. We want to know how the small area plan is going to impact social cohesion. Again, that's how we communicate and how we interact with the people that are in our environment. So important for stress levels, for immune response, actually studies have found, and for longer lives. So very important health determinant. Also physical activity and food access. Those are the three health determinants we want this HIA to look at. And then as far as how we're going to do this, so in the case study, they identified a few methods that included looking at data sources such as local crime data, U.S. Census data, other published research, and then talking to residents, talking to the Planning Commission, talking to other people that were stakeholders in the community. Those were all data sources for this HIA. All right, so the assessment phase. Again, this is kind of the meatiest part of the health impact assessment. So 4 main parts that go into the assessment phase. First is a community health profile. I gave a really, really brief table at the beginning that showed a few of the demographic characteristics. Community health profiles typically go into a little bit more detail than that, but we don't have that sort of time today. So after we understand whether our community is healthy or not, before we do this HIA, before this policy is implemented, then we need to really think about, well, how is this particular policy going to translate to health outcomes? What are the dots that are connecting, and how many connectors are there? Are there some immediate connections between the policy and health outcomes? Are there a couple of intermediate steps? These are the types of things we need to understand before we can start collecting data and looking for published research about some of the potential health impacts. And that's the third step, like I just said, collect some of that data. And then finally, we have everything we need to say, all right, this is how likely these health impacts will be. This is how severe they may or may not be. This is our strength of evidence. These are the number of people that will be impacted. That's the last step of that assessment, is really characterizing or really determining the strength and likelihood of some of those potential health impacts. So the last 3 steps, we're going to just sort of walk through in very brief form what the Duluth HIA walked through. And what we're going to focus on as far as that small area plan is just a tiny, tiny part of it, and those were proposed changes to sidewalks, or sidewalk improvements and expansion. And again, our 3 health determinants we're focusing on now are how sidewalk changes affect social cohesion, how it affects physical activity, and how it affects food access. So this is a pretty common scheme that you might see in any HIA. It's called a pathway diagram. Really, it tells us about the linkages between our proposed policy, which you can see here on the left, so improvements or expansion to our sidewalk network, and then it'll walk us through how we get to potential health outcomes. And a lot of this will be pretty intuitive for us, so we'll go through pretty quickly. So if you improve and expand sidewalks in a neighborhood, it makes it easier for people to get around. They have higher access. They use the sidewalks more. And also, you'd expect increased interaction among residents. Now, these are all hypotheticals. This is sort of before we would do our research. This is before we'd collect some of that data. But we want to know hypothetically what sorts of impacts might we see. Intermediate outcomes then would be increased physical activity because people are walking around more, increased social cohesion because people are walking around and seeing each other more, and then hopefully they're using their car less. So we might potentially see, we haven't done the research yet, in our neighborhood we'd see reduced air emissions. And now what does that mean for health outcomes? This is sort of the most important part of this pathway. Well, we hope to see increased mental health, right? Social cohesion, physical activity play into mental health, decreased chronic disease, hopefully, and also perhaps decreased respiratory illness if we really do make an impact on air emissions. So now we know, well, these are the linkages that we could see based on our policy change, sidewalk improvements. What is some data to support some of that? And that's the next step, is collecting that data. This can often be the most time-consuming part of a health impact assessment. But we need to collect data in sort of two different categories. What's going on right now? What does our community look like right now? And what are some things that might impact our specific community? And this is, again, going to be different for a community that's in Duluth versus a community that's in Atlanta, Georgia, or something like that. Each of these communities are going to react different to different changes to their environment. So for an example, if we wanted to research how sidewalk changes would impact social cohesion, we'd first want to know, well, what does our pedestrian traffic look like right now, right? We don't know if we're going to change anything if we don't know what our status quo is. And then through our research or through our stakeholder input, we might learn that connection to pedestrian centers would improve social cohesion if our sidewalks connect those pedestrian centers, and if our sidewalks meet the needs of everybody who's going to be using them. So again, pretty intuitive, but these are the types of things that we'd want to back up with some input from our stakeholders, with input from people that are living in the communities. So the second example then would be physical activity. What are some things we'd want to know about physical activity right now? How much do people get right now? What is the number of students that walk to school right now? And through talking with residents, through looking at published studies, we might learn that, well, physical activity will go up if we have a safe and convenient sidewalk network. Again, pretty intuitive, but something we'd want to be able to support. If we're going to bring it to our decision makers, we need to be able to support that data with people, with input from people that live in the community. And I'll ask for audience input for the last one. So what do you think are some questions we'd want to know for existing conditions when it comes to access to healthy food? And if we're thinking about HIA research questions. So what do we need to know right now for access to healthy food if we're proposing sidewalk changes in a neighborhood? Yeah, Paul called it. Number of grocery stores within walking distance. I did not show him these slides in advance. And we'd want to know if the bus routes, if people take the bus to the grocery stores, are the bus routes accessible by sidewalks, or is that something we need to pay attention to? What about potential impacts then? Let's just throw some ideas out there. Potential impacts to access for food when it comes to sidewalk improvement. What was that? Yeah, if we improve the sidewalks, more people are going to be using the bus. If it's so much so, do we need to start looking at whether our bus system can handle that? These are the types of things that we need to start carrying through as we're asking some of our research questions. We'd also want to know if proximity to a healthy food retailer is going to make a difference. If there's none in the neighborhood, sidewalk improvement in the neighborhood is not going to improve usage of those healthy food retailers that are somewhere else unless they are, in fact, connected by the bus system. Sidewalks get people to buses, and then buses get people to those healthy food retailers. So it can get a little bit convoluted and can get a little bit almost out of control sometimes asking a lot of these questions when it comes to understanding these potential health impacts. But it's also really kind of, like I said, the meatiest and the most important part of understanding those potential health impacts. All right, so we're near the end of our assessment now. We've collected all of our data. We've gotten input from our stakeholders. We're still in the assessment phase, but this is where we're going to characterize some of our impacts. So let me sort of walk through what this chart looks like. And again, this is pretty standard for any HIA, is to have the health determinants that you're looking at on the same chart as kind of understanding the direction. So will we have a positive or negative impact on health? How high or low will that impact be? That's our magnitude, our strength of evidence. So let's kind of walk through physical activity. So what the researchers found in our case study was that if we improve or expand the sidewalk network, physical activity will go up. That's our direction. That's a plus sign on our direction. How high or how much will it go up? Well, high. They said it would go up high. What's their strength of evidence? 4 out of 4 stars. So not only did the published research support it, but also talking to community members supported that outcome. All those things put together told the researchers that the likelihood of seeing this health impact, this positive health impact, was pretty likely, and that the distribution would be equal. So everybody who is in the neighborhood would feel those same positive impacts. Isn't this a really great decision chart to have? I mean, there's so many decisions you could use this decision chart for. I just think about maybe something like, what would be the health impacts if I were to bring onion and garlic dip to the party this Friday? Social cohesion, down. Magnitude, that's going to be pretty strong downward direction, to bring onion and garlic dip to a party. Likelihood is high. I've done it before. So this could be a very handy chart in a lot of different applications in our life. But really, joking aside, really it's good to communicate to our policymakers who might be looking at this report and saying, well, tell me what I really need to know. Everything you need to know is right here. This tells you exactly what the health impacts are, what the likelihood is, and how you're going to be able to back it up with information from people that live in the community and also from published research. So really powerful tool here. Okay, we've made it through the assessment phase. Now we can start to write up recommendations. This is how I think we should maybe modify this decision or modify this policy to really maximize some of those health benefits. So we're going to use the work we did during our assessment phase. We're going to use some of our stakeholder input, and that's what we'll use to make our recommendations. So here's some recommendations that came out of the Gary New Duluth Health Impact Assessment, just focusing now specifically on those sidewalk changes for social cohesion, to improve those health impacts, make sure the sidewalk lighting is good, that they're safe sidewalks, that the vegetation doesn't get in the way if it becomes overgrown or anything like that. When it comes to physical activity, make sure we remove the snow from the sidewalks in the wintertime so people can continue to use them, right? And then as far as access to healthy food, there were no healthy food outlets within the neighborhood, so that was an area where they needed to be able to connect people to the bus so people could access grocery stores and other healthy food retailers. So we made it through recommendations, put those in our report, and then finally we get to issue our report. And this is another really important step. You want to be able to get a hard copy out there, but you also want to be able to talk about your report, give a public testimony, give a presentation to decision makers, send your report to people that care. Heck, send your report to people that don't care but should care, right? You want to be able to get your results out there so that people can really understand how their decisions are going to be impacting community health. And then the last step, I know just when you want to celebrate and say, hey, I completed an HIA, there's one more step, and that's to do some monitoring and evaluation. So process-wise, did we follow our action plan? Did we meet the standards of a health impact assessment? When it comes to evaluating impact, did anybody listen to us? Did we get the word out there enough that people were able to take our recommendations in for their decision? And then monitor health outcomes. So you might start thinking about, well, did we improve the number of students that walk to school? Did we improve the number of people that are walking to bus stops? Were we able to keep more snow off the sidewalks in the wintertime so people could use them? Those are the types of things that we would track after the HIA is complete. All right, so one last question, audience participation question. This is actually a bit of a quiz. And let me get the poll going. Now, we did go through what would probably be a day and a half training on HIA in about 40 minutes or so, but either from memory or from the cheat sheet that's in your folders, see if you can select the correct order of the 6 steps of the HIA. Or select option D. Got a few more voters out there. I know we had a few people leave, so I think we've got everybody. All right, option B. We didn't have anybody say they're lost. Oh, I am so glad. I am so glad, you guys. And the B's have it. The B's have it. Yeah, that was a little bit tricky. The first one did swap around screening and scoping. That was meant to be a little bit tricky on purpose. Okay, thank you guys so much for coming to the workshop. We have our walking tour yet of the Cannery District, and there will be 2 different stops. We'll be learning a little bit more about the Cannery District, redevelopment plans there, and also talking a little bit about built environment. And Ned's going to give you kind of some prep information in just a minute. But are there any questions about the HIA process in general or more specifically? Gina, yeah. Yeah, she asked a question about if you want to see how a neighborhood's improving, how do you say, well, that's actual neighborhood improvement versus that's gentrification, because you might have some mobile populations. In the case study, I don't know exactly how they did that because they haven't published their evaluation report on their HIA yet. In general, that would be something that you'd have to decide in advance, is that something we're going to try to evaluate, and can we evaluate that? There's certainly plenty of HIAs that haven't had the resources to do that sort of long-term evaluation. Some can do it for a number of years. Some might only do it for a few months and not be able to track actual health outcomes. But that would be something where you should be able to, through working with community stakeholders, maybe working with organizations that are within that community, to be able to try to understand, well, how much neighborhood turnover have we seen over the last few years, and hopefully try to get an idea from there. But that's not my area of expertise, so I can't say the perfect way to track that sort of thing. Yeah, I think so. Ruth. Yeah, Ruth asked, out of all the steps, and for the Cannery District HIA, which one are we on? We are still on scoping. So we are still trying to determine exactly what sort of health determinants should we focus on, who should be involved, what types of stakeholder engagement activities are we going to do. So we're still pretty premature on that. And it's a 2-year timeline, so with tracking. So we hope to have a report in about a year and a half, and then have the last couple months to do tracking and evaluation. Yeah. She asked the technical question. So what have we done so far for scoping here for the health impact assessment? Well, this is actually one of our activities. Part of our research project is to get an idea of what the community knows about health impact assessments. It's not a science that's been used here very much in Eau Claire. And in general, it's very young. So this is one of our first workshops. We'll be doing more workshops throughout the upcoming months to get an idea of what people know about health impact assessment. We've also been just starting to work on some of our stakeholder engagement. So thinking about what are some events that we can do for outreach to talk to people in the community and ask them, talk to people in the West Riverside district specifically and ask them, well, what do you think is healthy about your community? What do you think is not healthy about your community? And starting to get some of those ideas there. We have not even yet finalized our overseeing committee, so we are still quite early in the scoping phase. Any other questions? Okay, I'm going to turn it over to Ned then, and he's going to prep us for our walking tour.
Excellent job. Yeah. Can't forget that, can you? All right. We're just going to do a little prep here before we leave, but this is an opportunity to have some physical activity now too, since we've been sitting for so long. But just want to prep you for this. So you have in your green folder the map, and we're going to split in 2 groups. So Gina Schemenauer is going to lead one group, and that group is going to go to stop B first. And we're going to look more initially at the redevelopment area. And then Audrey is going to lead group A, and they're going to look at the existing neighborhood. And then we're going to swap. We're going to go, group B will basically go opposite of the arrows. So that's going to be the layout. Gina is up there in the pink shirt. She's going to lead us out through the clinic entrance, and Audrey's going to go out through the main hospital exit. Also, in your packets, what we want you to be thinking about to engage and make observations is this walk audit tool, green handout. And there's two sides of it. Stop A references the existing neighborhood. And so when you walk through that area up to A and up towards B, that's the existing neighborhood. You're going to get a real good sense of the place in terms of what's happening. And the 5 categories here are really what adds up to what makes a healthy place. These are principles that have been founded in research. And so observe, on the fly, rate these observations on a scale quickly in terms of what you're seeing, what you're feeling, what's unsafe, what's difficult, what's good in these places as you move along on the sidewalks. It's amazing how a sidewalk is just such an important little piece of the built environment. So we'll go through that. But then also when you get to stop B and as you head back down along Oxford Avenue to Quick Trip and such, also take a look at it from the future point of view in terms of what might actually be good here for the redevelopment's sake. We've been hearing about Phoenix Park and what's worked really well there for health. And so also think about what could work real well, whether it's active transportation, food in the built environment, some of these different sessions that you heard today. What are actual interventions that we can see in the built environment in a new redevelopment of this place? So that's basically what we want you to do. At the end of that, we'd like you to turn in the green sheets, and then also the research sheet. At the end, we'll have administered by public health professionals a quick 6-question little research questionnaire that we'd like you to also turn in terms of the research part of this whole workshop. So thank you for being involved in the research component as well. Any questions before we head out? The clickers you can leave, there's a table at the back there. You can lay them there. And then I'm going to collect the waivers at the back because we don't want the city to be sued. All right? So with that, we're going to adjourn. Thank you.